Welcome back to STL Live. I'm Andy Ruzicka. My guests are the Health Services Administrator, Michele Bildner, and Government Services Agent, Craig Schmid. And we're learning about the Community Health Improvement Plan. Again, tell us more about this program. And my question is to you, Michele. You were talking earlier in the first segment about the social determinants of health. What did you mean by that?
Yeah, so that is a term that really describes the conditions where people live, learn, work, play, worship. Those all shape your health outcomes, right? So it's not limited to only healthcare or going to the doctor, but we know that your neighborhood zip code is more important than your genetic code. That's kind of the simpler way to say it. And through the CHIP, or the Community Health Improvement Plan, we are hoping to address those root causes of health, first and foremost, to do that true primary prevention work that public health is so good at.
So does that mean the people that live closer to, say, an industrial park, is that what you mean there? They're living closer to maybe an area with higher pollutants?
Yeah, that's part of it. It could also be that your community maybe doesn't have enough of the right assets that you need to be healthy. Maybe you don't have the best opportunities to buy the healthiest food, or you're not close enough to a transit stop or a transit hub so you can access public transportation. So that's a great example.
And Craig, what are the racial, you guys talked also about the racial component. How does that play in as well to health?
So in terms of the social determinants of health, you have things like education and transportation and housing and all of those. And when we look at a lot of these with regard to the various zip codes and neighborhoods, we notice that there's different layers that overlay one another with regard to that. You might have poverty, you might have lack of transportation, inadequate education, and that often occurs in our areas where we have African American or other minorities, people for whom the majority populations have not been paying as much attention to as we ought to in terms of investing in those communities. So we look at that to try to make sure that we're not just improving the health and well-being of the entire community, but specifically for those areas with the greatest needs. So those are social determinants of health, and that racial equity piece as well.
It's probably fascinating to be able to see that data and be able to recognize it, right?
Yeah.
So the data are important, but the stories that are told by those individuals that really bring that to life are important. So yeah, seeing the graphs and all the specific data are helpful, but then seeing what that translates into in terms of people's real lives, and that's the significance of public health, frankly.
And you do other events to try to raise awareness about this, don't you?
Definitely. So we will be able to show the community and partners who work with the community some of the data that we use to inform the plan, and we'll also be showing the progress that's been made across all those different health areas with the plan in September. So we're having an event that's open to community down at the Department of Health building at 1520 Market Street. That'll be September 12th from 1 to 4. It's an open house style. You can drop in for as long as you like or stay for as little as you like. But we do plan on engaging the community more in that way, at least twice a year. And all of our partner groups work with the community hand in hand. So,
is there kind of like an event thing? Are there booths for them to go get information on different things they may need?
Definitely. So we will have an interactive event where people entering will get a program that outlines who they can expect to see there, and then also a little fun activity to kind of go in and talk to those different teams so they can really get some more information and see how to get involved.
So this event, Craig, it's a 5-year plan, and right now it's city and county, correct?
And the other public health systems and partners throughout the entire community. And you're part of it, actually.
And is there a plan to go maybe statewide at some point?
No. But the state has plans as well, and we're all part of it.
Yeah, we do try to align our priorities with looking at what is happening nationally across the state, region, but definitely the local context is the most important. So we do look for that alignment.
So in terms of the statewide, a lot of times we're looking at policies that impact the local.
Okay.
Definitely.
Great information. I hope a lot of people come to that event, the open
Yeah.
house coming up in September. The Department of Health's primary goal is to create healthier communities. It's located at 1520 Market Street in room 4051. It's open Monday through Friday, 8 a.m. to 5 p.m. For more information, call 314-612-5100 or visit stlouis-mo.gov. There's more STL Live after this. Don't go anywhere.